Welcome back. The deadline to choose a Medicare plan is fast approaching. In fact, it's on December 7th. And if you're a veteran, you need to make sure that you're aware that your VA benefits and your Medicare plan can work together. Let's find out more right now.
The yearly Medicare Advantage and prescription drug plan enrollment deadline is fast approaching on December 7th. And for the millions of people who qualify for Medicare, including our country's veterans, some important decisions are looming. For the 9 million veterans who turn to the VA health system for care, many may not realize how Medicare and VA benefits can work together. Ed Sandrick, director of the Veteran Channel for Humana and a retired colonel with the U.S. Marine Corps, is joining us to help sift through what we need to know before choosing a plan. Ed, thanks for joining us today.
Thank you for having me, Christina. I appreciate it. Good to be with you.
When does the annual Medicare enrollment period take place this year?
The annual enrollment period this year began October 15th, and it will end December 7th. So while we're right in the middle of it, there's still plenty of time for individuals eligible for Medicare, including the veterans, to talk with a licensed agent, visit websites to get all the information they can to make sure they're making a decision that they're going to be comfortable with in 2022.
What should eligible beneficiaries, including veterans, know about selecting a Medicare Advantage plan for the coming year?
There's a long list of things, I'm sure, but I'm gonna mention 4 key attributes that I think we all ought to look at when we're looking at a Medicare Advantage plan. Most of the Medicare Advantage plans, if not all of them, have provider networks attached to them. So I want to make sure that my doctors are in the network, the hospitals that they admit to are in the network, and other key providers. So the network is very important, whether I use the VA or not. The cost of the plan, the monthly premium, really want to understand what that's going to look like. And then the cost as I use the plan, the co-payments, deductibles, co-insurance, those sorts of things. Medications. Most seniors are on prescription medication, and I want to make sure that if I'm looking at a plan that has a prescription drug benefit attached to it, that my drugs, my prescriptions are included in the formularies. And then budgets. Most seniors are on fixed income, and budgets are an important consideration. So what were my medical expenses and healthcare expenses like this year? And what may they look like next year? So I want to consider what my expenses were this year, and what my budget is going to be in 2022.
Can Medicare Advantage and VA benefits work together?
VA healthcare and Medicare Advantage can work side by side. The two are separate programs. So those veterans who are eligible and utilize the VA can use their VA healthcare benefits if and when they choose. Similarly, if they're enrolled in a Medicare Advantage plan, they can use the benefits and networks that are available in the network in the Medicare Advantage plan. The two systems do not conflict with one another. They don't coordinate with one another. The good news for veterans is they can use both. It's kind of the best of both worlds. Additionally, I want to mention that Humana for the last 3 years has offered the Humana Honor Medicare Advantage plan, which is a Medicare Advantage plan designed with veterans who use the VA in mind to complement and round out that care. The Honor plan is available to anybody who's eligible for Medicare, but it was designed with veterans in mind, again, to complement the care they get at the VA. The other thing I want to mention is that our Humana Medicare Advantage plans are recommended by USAA. We're very proud of that. They're a company that's known for its service and commitment to veterans and their families, and we're just really, really pleased and honored that the USAA has recommended our plans.
Tell us more about the Humana Honor plans and how to know if it is a plan that you should consider.
Sure. Well, again, the Honor plan is available to anybody eligible for Medicare, but it was designed with veterans in mind, again, to round out the care that they get at the VA. The key attributes of the Honor plan are that there is zero premium, so there's no monthly premium. The Honor plan comes with a robust dental coverage, and there are extensive urgent care networks. So if an individual who's on the Honor plan, a veteran or not, but for the veterans, if they can't get to the VA, access to urgent care is a key consideration. But veterans can enroll in any Medicare Advantage plan. It's just that the Honor plan was designed with veterans in mind. And again, any individual eligible for Medicare can enroll in the Honor Plan.
And where can we get more information about all of this that you've discussed today?
Medicare.gov has a wealth of information out there. So individuals eligible for Medicare or folks helping and guiding them, go to Medicare.gov, or you certainly can go to Humana.com/Medicare to see what Humana has available in your area, and even arrange to talk with a licensed agent over the phone, or arrange a safe interview in person if that would be of benefit. Again, I'd recommend talking with a licensed agent that they can help you make the right decision, consider everything.
Well, thank you so much, Ed Sandrick, for joining us today from Humana. I really appreciate this important information about how Medicare and VA benefits can work together for everyone's advantage. So thank you so much for this important information.
Thank you for having me, Christine. Have a great day.